Live from the North Carolina Museum of Natural Sciences in beautiful downtown Raleigh. It's the Science Cafe with your host, Brian Mallow.
Yay. Yay, the best opening word. Welcome to the Daily Planet Cafe here at the Nature Research Center at the North Carolina Museum of Natural Sciences. It's Thursday night, so that means it's Science Thursday here, and this is our Science Cafe. And I see a lot of people that I recognize, but it seems like, are there some people here that have never been here before? Excellent, welcome. Did you come out for this topic in particular? Yeah, it's not just random. Excellent. Well, we do this every Thursday, or we do something like this every Thursday night. Next Thursday is actually Brain Awareness Week, so there'll be a lot of other stuff going on out here, and our program is about nicotine addiction. And then the week after that is our fifth Science Spelling Bee. Fourth? It's our next Science Spelling Bee. And so we encourage you to sign up with Katie, teams. It's been really fun. I hosted, of course, it's fun. What? Or you can just come cheer on. We're trying to turn Science Spelling Bee contest into a spectator sport. You can help us do that. And then the week after that is the Zika virus. Yes. And everyone here will be inoculated with it. Isn't that awesome? So don't miss that one. Yeah, so that'll be a very interesting one. We're very excited about that. So anyway, and then the first of the month is Science Trivia Night. So, and then it goes on and on like that. But how about this program? We're really excited. You know what's really interesting? In the Triangle, there's so much cutting edge science going on in so many different things. And we've actually been in this sort of field for our cafes numerous times before, but veterinary science, weirdly, is one of the things that there's absolutely cutting edge science going on here, right here at NC State. And our guests tonight they're both from NC State, but they're from different departments, but they come together in this area of sports medicine, and both for animals, like horses in particular, and human athletes. So injuries and new techniques for regeneration and prosthetics. So we're gonna find out some pretty cool stuff. So as always, it's half our program is their presentation, followed by Q&A. So we hope that you'll participate, ask interesting questions. And all our shows are recorded, and they're streaming live on livestream.com and YouTube, and they'll be there archived there later if you want to see them. So, with no further ado, are you ready for our program? Yes. As I said, both from NC State, but Dr. Lauren Schnabel is in sports medicine, an equine orthopedic surgeon, and Dr. Matthew Fisher is a biomedical engineer. So, how about a nice welcome for them? Switch your microphones to on and take it away. Thanks.
Thanks everyone for having us. So as you said, my name is Matthew Fisher. I'm an engineer by training, so I'm not a veterinarian. And I'm in the Joint Department of Biomedical Engineering, which spans both NC State and UNC. So it's the only department that goes across the two universities. So we bond over disliking Duke, and that's about it.
Hey, remember where I went to school.
Sorry. So I'm an engineer, so I like to make things, and I'm a biomedical engineer, which means I like to make things to help solve biological or medical problems. And that's what I do, and I do it for musculoskeletal tissues, as you'll hear today.
Excellent. And again, thank you for coming this evening. We didn't realize we were up against paint a poop, so we're glad you came to watch us here today. So I'm Lauren. I am an equine orthopedic surgeon, also boarded in sports medicine and rehabilitation, which is a really new field for equine. So in the clinic, I work on diagnosing horses with lameness problems. Sometimes that involves surgery, sometimes it's regenerative therapies, or a combination thereof. And then more recently, we're working on tailoring specific rehabilitation protocols to that horse to get them back to athletic work quicker. And in the laboratory, I do stem cell research, mostly focused on immunology of stem cells, and a lot of work with Matt on ways we can use those stem cells most effectively for healing. So today we're going to talk to you about horses and humans. And as many of you know, horses and humans are both elite athletes. So they're often compared in terms of their speed for racing, but also for their ability to perform very refined and complex movements, as you can see with this dressage horse being compared to a ballet dancer. And in the media, there's been this athletic ability of the horse has been recognized, especially this past year with American Pharoah winning the Triple Crown and actually some very tough races even after that. So a really amazing horse. And no one had won the Triple Crown in a long time. So trivia, who was the last horse to win the Triple Crown before American Pharoah? Alex can't answer. Who? Nope. Affirmed. Very good. Year? Do you know the year? 1978. Very good. Excellent. See, we could have trivia tonight, too. So, and I thought this was cute. It was American Pharoah giving retirement advice to Kobe Bryant. So American Pharoah was fortunate enough not to get injured during all his racing, and they stopped him at that point for breeding. Kobe Bryant, as you know, has had many injuries. And that's the cool thing about both horses and humans, and why they're such a good model, horses are, for the human, is because they have very similar demands, and as such they suffer from very similar diseases and orthopedic injuries, making them an ideal model for humans. So I'm going to pass it over to Matt.
Okay, so I'm going to talk a little bit about what the problem is. Okay, so for human orthopedic injuries, the costs number in the hundreds of billions of dollars per year in the U.S. alone, and that includes both healthcare costs as well as lost productivity due to missed work. And when you think about orthopedic injuries or musculoskeletal injuries, you often think about the two words that make up musculoskeletal, so muscles, and then skeletal, which really means bones. But there are actually a lot more things involved. So in these schematics, there's a bunch of different tissues that connect the bones to bones and the muscles to bones, okay? So if you're going to connect bones to bones, they're called ligaments, or muscles to bones are called tendons. And then the bony surfaces are also lined with another tissue that helps bear compressive loads, and this is called cartilage. And so all these tissues, in addition to the bones and muscles, contribute to the function of how we move around all the time. So if we look at what the problem is, we first need to assess, well, do tendons and cartilage heal by their own naturally? And so if you look at the picture on the left, you can see a normal tendon, and it's got highly aligned matrix. And this matrix is made up mostly of collagen and allows it to bear tensile loads similar to a rope in a single direction. And the dark purple specks in there are the cells that make up, that are called tenocytes that live in the matrix. And all these cells are aligned along the collagen as well. So when a tendon gets injured, it gets torn. As you can see in the second picture there, there's a gap that forms. And immediately after that gap forms, there's an inflammatory response. So a bunch of inflammatory cells come in and try to clean up that wound. And then over time, new cells come in and produce new matrix. So in that next picture, you can see a whole bunch of dark purple specks. And then over a period of years, eventually you get the matrix to start to align again, and you see a lot less cells. But again, in that last picture on the right, the cells are still more, there are a lot more cells than the normal tendon, and the matrix is still not quite as aligned as it used to be. So you're left with a scar with reduced strength. Now these are in tendons that can heal. There are a lot of ligaments and tendons that don't heal, like the ones inside your joint. So if you guys have heard of anterior cruciate ligament injuries, for example, in sports, those often have to be replaced entirely because those ligaments just do not heal on their own. Cartilage is similar. So here you can see two pictures from inside the knee joint, or the knee equivalent, looking at cartilage defects. So it kind of looks like a pothole in the middle of the street. So the cartilage itself is white, and the underlying bone is more tan or pink. So which one of these images do you think is from a horse, and which one is from a human? Any guesses? Any guesses? Left? Human? All right, well, you guys are about 50-50, so it's a random guess. So the one on the left is from a horse, and the one on the right is from a human. And what happens is if you let these small defects go for a long enough time, it causes ongoing degeneration, and if you let them go long enough, all the cartilage wears away, and you're left with bone, only bone, and that's what's called arthritis. So that's really the problem that we're trying to deal with. And a lot of what we do in the lab is focused on regenerating these lost tissues. And we have a number of strategies that we can try that we're going to go into. One of them is called platelet-rich plasma, which is basically, you can think of it as a GNC supplement maybe for cells. The cells are us, maybe. And then the scaffolds are where we live, okay? So the the environment around us. And a lot of these strategies have been pioneered in horses and are now used in human medicine. And now Lauren will tell you about how some of these have been used for tendons and tendon treatment in horses.
Excellent. All right, so how many of you have heard of platelet-rich plasma, or PRP? Oh, good. Good number of you. Excellent. So platelet-rich plasma is really based upon the principle that platelets are a huge source of growth factors. So they have these alpha granules which contain their growth factors, and upon activation, those growth factors are released. So it's actually very simple to make platelet-rich plasma. It's harvesting your own blood or the horse's own blood in a syringe system like this, like we have on the screen, on the stand up there, and that's going to concentrate out the platelets, and you're going to pull that part up to then use for your injection. So these are simple systems to use, but quite powerful in the number of growth factors that they contain. So we did the early studies on platelet-rich plasma in the horse in my mentor's lab. We started up at Cornell, and we've done others since, as have other groups. But I wanted to point out that these equine studies are published in human orthopedic journals, and they were really the starting point for PRP being used in human medicine. So in the examples you can see on the screen here, the top two pictures are injured tendons treated by placebo or with a saline injection, and the bottom are with platelet-rich plasma, or PRP. So I hope you can see, as Matt explained, that the PRP-treated tendons have more fiber alignment, they're more organized like tendons should be, and less cellular. And since that time, which that was our first paper was back in 2006, this has really become a common treatment in horses for the treatment of tendon and ligament injuries. And it's like I said, it's a very simple thing that we can use to start with good results, often even while we have stem cells growing up in the laboratory. We have lots of controlled studies in the horse. In people, it's being used a lot, platelet-rich plasma, but I would say with less scientific evidence for certain conditions. So it's being tried a lot, but we need more controlled studies in people, especially to know which kind of PRP to use, because there's many different systems available. But as you'll see, even in some of the big review articles for human medicine, actually the authors are veterinarians, and that's been a trend in orthopedics. So I just wanted to point that out because I think it's pretty cool. And as I mentioned, there's some really popular athletes have been treated with PRP, right, that you guys have seen in the news. So again, Kobe Bryant, Tiger Woods, A-Rod, and others. So they've publicized this as being a mainstay of treatment, or a popular treatment now in human athletes, but we really need to still work on some of the science behind this. Okay, so that's a quick overview of PRP, and we're going to move on to stem cells. So stem cells, just a very basic definition, is undifferentiated cells that are capable of both self-renewal and differentiation into specific lineages. So as we have on the screen up here, ectoderm, endoderm, and mesoderm, which are the three main germ layers. For orthopedic conditions or musculoskeletal, we're worried about the mesoderm because that's muscle, bone, tendons, cartilage. And in adult horses, there's two main ways that we get these stem cells, and that's from the bone marrow, either from their sternum, which I'll show you guys a video, or from their ilium, which is by their hip, or you can take fat from around their rump. And then these cells can be, you can process these tissues either in the lab by culturing them for a couple of weeks, which is what we normally do, or by quick centrifugation processes. And I did want to point out that while stem cells can differentiate into specific tissues, the adult MSCs, or mesenchymal stem cells as we call them, really what they are, a potent way that they help healing is from the factors that they release. So they release a lot of important cytokines that are necessary for healing. They recruit other stem cells from the body. They help bring in a blood supply. So there's a lot that these cells do. So this, I thought you guys would like this video. This is a video of us, or me getting bone marrow from the sternum of a horse. So horses tolerate this amazingly well, and it does not appear to be very painful to them at all. So in the upper right-hand corner is a picture of a horse's sternum and then the marrow cavities. And then in the video, I was just blocking with a lidocaine block like you would get at the dentist to numb the skin and the periosteum that surrounds the bone. And then a needle like this guy is advanced into the bone marrow space. You can see it's a pretty, I'm not going to pass it around because it's a little bit of a weapon, but you can pass this up into the marrow cavity and then remove the inner part, and then you'll see in the video drawing out the bone marrow. So again, you can see this horse is just lightly sedated and standing in the stocks, and they really do tolerate this quite well. So similar to PRP, our early studies, again, published in human high-level orthopedic journals, and have had an impact on the human field since then. So we show that they help in tendon organization as they're healing with the right kind of collagen. So as tendons, we want to be made of collagen type 1. As they heal with collagen type 3. And then gradually over the repair process, 3 gets turned into 1. But with treatments like stem cells, we can actually help them, push them towards the normal type collagen from the beginning. And that's what you see in those fluorescent images on the right, where green is stained for type 1 collagen. And the MSC-treated tendons have more green compared to the controls. And what I think is the most convincing data, or what I always tell our clients about in the hospital, is this data. This is from a large group of national hunt horses in the UK, where they compared natural tendon injuries. This is the superficial digital flexor tendon, which is a very common tendon for race horses to injure, or bow, as we call it. And these horses were treated with stem cells and then compared to race horses treated via conventional means. And what you can see, I hope you guys can see this graph, but in red is the traditional and blue is the stem cells. So there was a big drop in the re-injury rate. So horses that were treated with stem cells were a lot less likely to re-injure their tendon when they returned to racing. So that's a big deal. As Matt told you, that tendons heal with scar tissue, essentially, making them very prone to re-injury at that normal tendon scar interface. So we dropped the re-injury rate from up around 60% down to around 25 or 30% with the use of stem cells. So we're quite happy with those results. And this definitely gained a lot of media attention. So we were in Nature for using stem cells in veterinary clinics. That was me during my residency. And then on the right is an example saying how treatments used for racehorses can benefit people. In the human field, this is just at the start using stem cells. And again, I would just caution that there's still a lot of science that needs to be figured out in people before we can use these cells on a daily basis or routinely in people. But it's a great start to figuring this out and how they can help people. Another thing I wanted to show you guys was we've also worked very extensively in horses on the best way to deliver these cells. So in this video, this is an ultrasound or a sonogram of a horse's tendon, where we have, and my arrow got misplaced, I'm sorry, on the video, but that white line coming in there on the video is actually the needle. And then you can see the tendon filling up with the stem cells. So we do this under ultrasound guidance, making sure we're going right into the exact lesion or injury that we see on the ultrasound. And for that, in the case of the deep digital flexor tendon in this ultrasound, which is sort of on the mid-leg here, it's very easy to see those lesions with ultrasound. But there's other places in horses in their ligaments that we really can only find the injury on MRI. So this is what I'm showing you guys here. Is on the left is a picture of a horse in our MRI at school, at the vet school. So it's the same size bore or entry into the MRI as for people. So the whole horse can't fit through there, just a leg or their head. And if they're chubby, only part of their leg because you hit their belly. Onto the table. Yeah, so they are induced under general anesthesia, just like they would for surgery, and then they're hoisted by their legs upside down onto a table. I'll have to show you guys a video of that sometime. It's cool. And then they're just rolled down the hallway into MRI, and then they get back to the recovery stall the same way. But so for these horses where we can diagnose a lesion of a ligament, especially on the lower limb, by MRI, but we want to inject it with a regenerative therapy. Unfortunately, we can't do the injection while they're in the magnet. For obvious reasons, we'd be stuck to the magnet, and it's not safe that way. But we came up with a very cool system used in Europe for some human abdominal procedures. But we were the first ones to use this in the veterinary school and here in the US. So this was with the help of our radiology department, or pioneered by our radiologists here. So what this does is you can take the MRI images from the horses under general and load it onto our ultrasound machine. Then we can use a GPS guided system around the horse's leg, and I think you can see there's a magnet on the ultrasound probe as well, so that it tracks where you are on the leg as you're ultrasounding the horse in real time. And you lock on a piece of the anatomy, so like sesamoid bones in the horse's lower limb. And then it's locked on so that as you go up and down the limb with your ultrasound, you're watching where you are on the MRI. And then you can inject right into the lesion you see on MRI. So this is a video of that. I don't think my pointer is going to work, but in the upper right corner, we're looking at the MRI of the horse with a lesion, which is white, the injured area in white, on an oblique sesamoidean ligament. And then on the left side is that same area on the ultrasound. And you can see the needle come in and deliver our stem cells, which is the swirling and the filling. So that, again, that lesion or injury is much more obvious on the MRI than it is on the ultrasound, but using both, we can perform a very guided injection of our stem cells to that injured area. So this is a cool technique that we like to use. All right, I think, let's see if I can get to the next slide. There we go. I'm going to pass it over to Matt.
That's enough about horses. Joking. So I'm going to talk a little bit about scaffolds. So what if in some cases of tendon injury, there's enough matrix there, or the cells have enough room to make enough matrix, but what if there's not enough to make? What if the cells just don't have a home to go to? In that case, we might need additional scaffolds, okay? So what you can see are just some example pictures of scaffolds. So we can make them in sheets, we can make them in 3D gels, we can make actually pretty complex shapes like that hemicircle that you can see there. And to us, they might and we can actually make really complex shapes as well. So one group made mini Death Stars. I don't think for nefarious purposes. But to us, on the surface, these scaffolds might look relatively the same, but remember, cells are really tiny, right, on the order of a few microns. So if the cells if a single scaffold looks the same to us, to a cell it might look quite different, right? So the image on the left looks, I don't know, more jagged in structure, whereas the one on the right looks a little more fibrous. And cells are just like us. They have to be comfortable, right, in their environment. So think of mattresses. Some people like stiff mattresses, some people like soft mattresses. Well, cells have a sleep number too, right? So they have to be the right matrix environment for them to survive and do well. So we can do this in a couple ways. We can put the scaffolds into the lesion with cells or something else, but what we've been working on recently is using scaffolds to precondition the cells before we then implant them. So just to give you an idea of what that might look like, this is what a normal tendon or ligament looks like under electron microscopy. So one of these is an immature tendon, and one of these is a mature tendon. Which one do you think is which? Which is on the left? Good, good. You guys are becoming scientists. And so what we can do is we can design scaffolds that kind of look like this. Okay, so this is a scaffold that we designed. It's made up of little fibers on the nanoscale that kind of looks somewhere in between these. Okay, and the most important part is that if we put cells on these scaffolds, they tend to align along the direction of those fibers, similar to the native tendon. Okay, so this might be a way to precondition our cells to get them to look like tendon cells before we ever put them in the body. In addition, we can take these and we can apply mechanical loads. Hopefully that's playing. But this is a bioreactor that we've made in my lab, and we put it in an incubator, and we have little cells on stretchy scaffolds, and we can stretch them similar to how we stretch in the morning or stretch to warm up before exercising to try to stimulate the cells to make more matrix. And so let's move on pretty briefly into cartilage before we wrap up. So the same things have been tried for cartilage, so PRP, okay? So in cartilage, you do PRP sorta, okay? So you take an awl and you drill into the bone, as that figure on the left shows. You can see a hole all the way down into the bone. And what happens is the blood comes out from the bone and it kind of forms a clot in the cartilage, which kind of works, but it doesn't really look like native cartilage. So what a lot of people have done is tried other techniques, okay? So this one has been around for a while, actually. This one is called autologous chondrocyte implantation, and it's done in both horses and humans. And the idea here is that you have an initial surgery to go in, and you take a small biopsy of your cartilage, okay? And the surgeon takes that, and he puts it in a tube and sends it to a lab. And the lab dices up the tissue, gets the cells out, lets them grow and make more cells, and then the lab sends back the tube. Okay, and the patient comes back for a second surgery, the patient's not on the table the whole time. The patient comes back for a second surgery, and then they use those cells to fill in where the actual defect is, okay? And then it's usually covered by some scaffold to try to keep it there. But there are a number of problems with this approach. First, you have to do 2 surgeries, right? That's not ideal. And second, is the cells, once they're injected, they're kind of in place, but they're not really in place. So a lot of people are generating next generation therapies for cartilage repair, okay? And these include using alternative cell sources that don't require that initial surgery, right? Or combining cells and putting them on scaffolds so that when you put them in, they're gonna stay there, okay? And they're gonna make a lot of matrix. So unfortunately, like Star Trek, it's still a little bit of science fiction in that it's not available, it's not clinically approved yet, but these are in the pipeline and they're going through clinical trials now. So the last thing I wanted to talk about was actually engineering cartilage, and we can again do this with scaffolds and cells. So in this case, we've taken stem cells and we've put them in a hydrogel. Okay, this hydrogel happens to be made of cartilage-like matrix, and it kind of looks like a Jell-O fruit cocktail. Okay, where the cells are the grapes and the Jell-O is sort of the hydrogel. But if we put this in culture over time, initially it kind of looks like the one on the left. You have light blue staining, and that blue staining means that it's more cartilage-like. And the normal cartilage you can see on the right. But as we culture these over time, we can see that they start to get darker and darker blue. And so over a period of a few weeks, we can actually get cartilage-like tissue in the lab, which we can then implant to treat cartilage defects. And so that's sort of the next generation, I think, of cartilage repair.
Excellent. So we just wanted to end with, I wanted to remind everybody that it's important that our efforts can't stop with these regenerative therapies alone. And I think that's one place actually where the horse has really lagged behind human medicine. So we wouldn't have a major orthopedic surgery and not do PT or physical therapy, right? And the same should be true for our equine athletes, but this is really coming along in the last couple of years now. So starting our program at NC State, and we hope to have an aqua treadmill and a saltwater spa within the next couple of months, so very exciting for us. So just some pictures there of a horse in the saltwater spa, which is great for reducing edema or swelling and for other injuries as well. And then an aqua treadmill, which allows them to work with some buoyancy from the water to take some of the pressure off their legs. And a plug for the open house. So it's in April. I think you have flyers on your table, but we'd love to see you at the vet school if you want to come check out everything that we do there.
And we also have an engineering open house next Saturday, if you're interested as well.
Excellent. Well, how about a nice round of applause for Dr. Lauren Schnabel and Dr. Matthew Fisher. And that was excellent. And the rest of our program will be Q&A. And because we do record the programs, I just ask everyone, get my attention, and I'll try to get to you in the order you're try more than once to get my attention. And I'll kick us off because I'm curious how you got into this field in particular. Horses, were you found and raised by a family of horses? Was there something formative when you were young? Why horses and this specific area?
Yeah, no, that's a great question. I was raised with horses, not by them. And my family always had a love for racehorses. I grew up in New York, so I always grew up watching thoroughbred racing, and then also rode different hunters is what I did, still do. And then when I always wanted to be a vet from the time I was a little kid, which seems to be a trend among veterinarians. I worked for a small animal vet for actually a long time, but then when I was in vet school, I just only wanted to be in the barn, only wanted to be near horses, and it just went on from there.
Yeah. And what about you, Matthew?
I've always liked to make things. So even as a little kid, Legos all the time. And as I got older in school, I really liked biology. So I wanted to solve more biologically related problems. So that's it.
Excellent.
2 quick yes or no's, then a third one. Number 1, will any of these treatments work on injuries that are 10 years old?
Yeah, that's a difficult question. So it is harder to have scar tissue and then have to start over. So sometimes we actually have to remove the scar tissue first and then start over basically like from zero to build up new tissue. We do that in tendons. There's a procedure actually called FAST, or focused aspiration of scar tissue. We're putting a needle into the tendon under ultrasound guidance and aspirating out the scar and then putting our stem cells or PRP in its place. Because once you have a scar, it's quite hard to change that. Yeah.
maybe this one will be yes or no. Can you use equine
sorry.
PRP on humans?
Yeah, you don't want to do that.
Okay. Now the third one.
No.
If why can't they just implant a synthetic ligament or tendon?
They can, and they have. So back in the 80s, actually, well, so for anterior cruciate ligament injuries, for example, a common treatment right now is either you take a tendon from your own body or you take a tendon from a cadaveric source. And those work okay, but the long-term risks of secondary damage to your joint are still really high. Back in the 80s, actually, they developed synthetic ligaments out of Dacron and other things. But what happens is that with those particular materials, they started to get wear. Okay, so once you cycle them a few thousand times, the synthetic molecules start to break down, and it releases particles, which then inflame the joint and cause, at that time, catastrophic damage. What people are working on now in terms of scaffolding for ACL injuries is actually making scaffolds that can work with the regenerative response to make a new ligament. So it's not just a synthetic ligament that's going to stay synthetic forever, but it's a synthetic ligament that will help whatever inflammatory response, or if you implant it into cells, make a new tissue, not a synthetic device.
I was just wondering what the scaffold's made out of.
Totally depends. So some scaffolds are made out of polymers, okay, or metals. Some of the ones that I showed were made out of polymers like polylactic acid, which is really common. Some of the biodegradable silverware is made out of PLA. Some of the other scaffolds are made out of actual tissues that have been decellularized, so the cells have been removed. But it maintains the collagen structure, and it maintains some of those growth factors and some of those PRP-like things in the matrix, so that when you implant it, it tries to stimulate a regenerative response. But the type of material that you choose totally depends on your application.
So first, just a comment and then a question. It was interesting to me to find out that there are things in our bodies that are not cells. Like, you know, collagen, I guess, is not cells. So that was new to me. I thought we were just cells. And the question has to do with the relationship between horses and people as models for one another. Horses must not be perfect models for human beings. So I'm wondering, first, kind of what makes them good models, and then second, what are the limits of them being models?
Sure, yeah.
I'll let you take that one.
So what makes them good models is that they are very good athletes. So they have to work hard. They have similar demands as humans, and they undergo similar situations where they can get injured. And that's why what really makes them a good model is they actually get the same injuries as people. So very similar injuries because of that. I would say the downsides to the horse as a model are we can't tell them to stay in bed laying down, right? So that's, in all seriousness, that's a huge problem for us as surgeons treating horses, because it's very hard to rest a horse. So they can lay down, but they a lot of times want to be standing, and they overweight bear on their injured leg, and that's when they can founder or develop laminitis. Probably you guys have heard of, like with Barbaro, right? So we can sling them and try to do other things if they really have a severe injury, but that's our greatest challenge, is we can't make them rest very well. So we can keep them in a stall, but sometimes they're still very active and they're still bearing a lot of weight on their injury. Yeah, well, it's still the way they're built, though, as they have their hind limbs have a locking mechanism where they actually lock into place so that they can sleep standing up. So that is why they often do that. So it's kind of both. They're prey animals, so they're flight animals, so they're going to have some of those tendencies to be, to spook and run and things that are harmful to them when they're injured. But that's part of the way they are. Yeah.
So I'll just add something. So another thing is the size of the tissues. Okay, so human cartilage might be a few millimeters thick, 2 to 3 to 5 millimeters thick. Horse cartilage is on the order of 2 to 3 millimeters, somewhere in that range. If you were to look at the same joint, same location for like a dog or a sheep or a goat, it's going to be an order of magnitude lower in terms of the thickness. Okay, so if you're trying to practice or trying to prove a regenerative therapy, like injecting cells, it's important to have that same size scale.
Thank you. About 15 years ago, I had a serious break to my right elbow, and as part of that process, I was told that one of the tendons in my forearm had completely snapped.
Yeah.
And the doctor at the time said, that's not going to be repaired. And I've had no repercussions from that. So how did my body work? I mean, everything works fine. I had a lot of rehabilitation therapy, though.
Yeah, I would say there are some tendons that are more crucial than others. So we have some extensor tendons and some flexor tendons. So it does depend on which one you injure. So typically, especially in the horse, but in some degree to people too, the flexor tendons are way more important for carrying a load and performing a motion. So it does depend on which tendon, yeah.
It also depends on level of activity. So maybe it's okay, maybe you're fine, but if you were, say, maybe a major league pitcher, it might be
not fine.
more important, right?
So I was wondering about the difference between PRP, stem cells, and even the hydrogel in regenerating even some of the supportive tissues around the injured tendon or ligament, you know, vascular tissue, proprioceptive nerve tissue, anything. Is that also being regenerated when these injuries happen and you use these therapies?
Yeah, so we can both talk about this, but a major action of especially stem cells is to help with new blood vessel ingrowth, so angiogenesis, and a lot of other factors to lay down matrix in the area, so that's a huge part of what they do. PRP does to some extent too with the cytokines that it releases, but I would say stem cells are more potent in the factors they secrete that attract other cells and really help to build that matrix around the injured site. Yep.
Yeah, and so scaffolds can be designed to help with say, vascular infiltration or nerve regeneration as well. So,
two questions. In the early slides with the plasma-rich protein, what is the rate with and without the plasma-rich protein to achieve the same end result of healing? In other words, how much does it speed it up? And second, the brilliance that's up there, you can answer this question. When you put ice on something like this, what is the mechanism of action for reducing the inflammation?
Sure, we can tackle those. So in the first one, platelet-rich plasma, treated tendons, they actually, the untreated just with something like saline or placebo, they really don't ever get to the same point, generally speaking. So they even far on in the healing process, they look, the tendon is not as organized. So the matrix is disorganized, the fibers are going in different directions, and there are more cells. And I would say those never get to as organized as platelet-rich plasma. Does that make sense? So it's hard to look at a specific time point because they are healed but with a scar with inferior tissue. Yeah.
and ice.
And ice, so ice works actually by a couple different mechanisms, but even by causing vasoconstriction and stopping the inflammatory cytokines from getting into the area because of the vasoconstriction and reducing swelling that way is one of the main ways. Yeah.
Yes, hello.
Yeah.
So I'm more interested in knowing about how to avoid sports injuries, or at least permanent injury that would affect quality of life from a sports injury. So I've been running for like 20 years, and I'm in my 60s now, and I can still run. I don't run that much, maybe 10 miles a week.
Mm-hmm.
But I did like triathlons, shorter distance triathlons for like 17 years. And so I'm still running fine, but my question is, should I, will this inevitably end up in a permanent injury that, that I will, that would require some of these corrective actions, which I'd like to avoid, actually?
Yeah. You want me to?
Yeah, I can start anyway. So it's really a hot topic, right? What is the appropriate amount of exercise? We all know exercise is good, but overexertion can be bad too. Mm-hmm. So a lot of tendinopathies result from overexertion or just too much exercise and not enough rest, okay? And in some of these conditions, these are just slow degenerative conditions that just accumulate with aging. So there was a study where they looked back at 17,000 cases of looking inside a knee, and they found some form of cartilage damage in something like 50 to 60% of it. Now, that doesn't necessarily mean that you'll have symptoms, but there's always going to be some sort of degeneration. So I don't know that there's a correct answer, but exercise and then rest in between is probably.
Yeah, and I would say the way you train to be fit, right? So that is something, again, there are certain disciplines in horses that do that very well, like endurance racing and even eventing, where they have heart rate monitors on their horses and they're tracking fitness. So do you train with a heart rate monitor when you're running?
I'm aware of my heart rate,
Yeah.
so not always using a monitor, but depending if I'm on the bike, I use it. Yeah.
So I think that's a huge thing, is achieving the appropriate level of fitness to do the goal that you want to do, and that's probably the number one thing I would say that would prevent an injury.
I mean, so do you? I mean, is it advisable then to do some kind of preventative inspection along the way? Because I mean, when do you get to the point where, you know, you've already done the damage and it's not, you know, you're going to suffer through it?
Pain, then I wouldn't worry about it. It sounds like you're doing well. Change your shoes, wear good running shoes, and all the things you can for support. But then the first sign of pain, you want to say, whoa, I need to back down and I may need to get this checked out.
Okay, so two other quick questions. One is, we talked about artificial tendons and ligaments. Is there artificial cartilage available now?
Yeah, I mean, so one cartilage, there are a couple different cartilage treatments. I mentioned the tissue engineered ones, which are ones that we make in the lab. But there are techniques for large cartilage defects where you might take a piece of cartilage from another portion in your own knee, or you might take one from a cadaveric source to fill in that defect. Those are called osteochondral grafting or grafts. Yeah.
And the last question is there any benefit to taking collagen having collagen in your diet?
Collagen, I don't know, but there have been studies on taking in glycosaminoglycan pills. So these glycosaminoglycan pills, you can buy them, I think, at GNC or wherever, and take them orally. And there was a study done in dogs where they found that about 2% of that ended up in your joint. And those GAGs are an important extracellular matrix protein for cartilage. So I don't know how much 2% helps, but it does. If you take it orally, it will get into your joints. So
I just wondered if you were using any 3D printers to make the scaffoldings or to do any of that work.
So we do some of that, and it really depends on the application. So for easy shapes, you don't necessarily need it. You can make a scaffold or you can form a scaffold by itself. But if it's a really complex shape and it needs to be specific to you versus anyone else in this room, 3D printing comes in really handy. So there are these tissues in your knee joint. They're called meniscus. So they have a really complex shape. So that really weird C-looking thing that I showed, that was modeled after a meniscus. But that wasn't modeled after your meniscus or my meniscus. It was just a generic one. But using 3D printing, we can actually get patient-specific geometry now.
Back in the mid-'70s, there was a horse race, Ruffian and Foolish Pleasure.
Yep.
Ruffian was injured catastrophically. Yep. Would there be things today that could have prevented her demise?
Lauren.
So, yes, yes, I know Ruffian well. So that same injury still happens to horses today, right? So what that horse had, so she had an open catastrophic condylar fracture with sesamoid fractures. So unfortunately, that does still happen. There's been a lot of research on the track surface and the training programs, but what it comes down to is ultimately they're racing at such high speeds and with such force that sometimes you do have failures where their suspensory apparatus breaks down and you have a fracture. So unfortunately, that does still happen. And those are still honestly quite hard to repair for us, or next to impossible to repair when they're that catastrophic. So that's still something that's being worked on. Luckily, they're fairly far and few in between, but they do happen, fortunately.
Can I ask you, this is sort of a veterinary medicine history question. Because when you said demise, did you mean the death was the, like, so there was a time that horses, if like a leg injury would result in someone just putting the horse down, right?
Yes, and that still happens.
And so what I wondered if there was a point that stopped happening and it was attributable to any particular developments in medicine that is
So I
like,
think
we
we've
don't need to do that at all.
Yeah, I can explain. So we've gotten much better at this. At some point, there's a point in the long bones of a horse, the big ones like humerus, femur, where we just truly don't have strong enough equipment to repair them, even though we have really good plates now. And then it comes down to what we talked about, where horses don't lay down for extended periods of time to rest. So they're always usually putting some degree of weight on that fracture that we've just repaired. The other problems with horses is their fractures are often under very traumatic, high force fractures. And if their skin is open as part of that, then the implants you put in are gonna get infected. They're going to. And that's very difficult to overcome. And sometimes we can, but sometimes we can't. But the racehorse breakdown injuries like that are a combination of complete ligament disruption and bone and open skin generally. So those are very difficult. Yeah.
These scaffolds that you implant into the body, do they remain intact for the rest of the life? Do they break down like, you know, the sutures that you don't have to have taken out in the future?
It totally depends on the material that you use and the application. So some materials degrade very quickly. Okay, so some sutures will just resorb on their own. Okay, these are generally made of polyglycolic acid, or it's a polymer, but other ones will just stay forever. And so it just depends on the application. That's why a surgeon chooses a suture versus another. And it's exactly the same for biomaterials.
So North Carolina is not necessarily known. I mean, obviously there's the horse center out there and the state fairgrounds, but we're not necessarily horse country. We're talking about, you know, racing horses and equestrian and so forth. So where does NC State stand within the equine world in the work that you're doing here?
Yeah, so actually, despite North Carolina is not a racing state, that's absolutely true. We do, however, get some standardbreds that come here for the winter in Pinehurst, and we do see those racehorses at NC State. But this is actually a huge population of horses in North Carolina, sport horses. So actually, Southern Pines is a real mecca for eventing with some Olympic-level trainers there, ton of horses there, and also a lot of local horses. Also, recently, we're very fortunate. Do you know where Tryon is in the mountains? So they built a giant Tryon International Equestrian Center, which is actually competing with Wellington for all the big competitions for horses. So that still, they close during the major 3 winter months when it's cold in the mountains, but otherwise we're actually quite thrilled to have that equestrian facility nearby us, and we're working with them as well. But I would say that we do have an excellent caseload, which has helped us build a reputation clinically and then also in the research aspect. And we're blessed to be where we are and surrounded in the triangle by UNC and Duke and joined with UNC, because that's really how you do effective research, right? So we collaborate with each other and with the human clinicians and physicians, surgeons. So yeah, I guess that's what I would say. I think we have an excellent population of horses in this area, really high-level horses.
So the scaffolding that you put in, is there any process for removing that scaffolding? Or does it degrade over time, or is it just permanently in the body?
Right, so it's a similar question. It totally depends on what you want it to do. So we can make scaffolds that will just stay there forever, and we can make scaffolds that will degrade over time. And it just depends on the application as to what the best process is. So for example, if you're getting a knee replacement, you don't want that to go away over time, right? If you're, I don't know, doing something else in the tendon where you're going to get new tissue to form in, maybe you want that scaffold to go away so that it gets out of the way for the new tissue to fill in.
Hi. Do they really use placebos on horses?
You do. Mm-hmm. So certainly a lot of it is that the study is blinded to the owner, right? So yes, you need to use placebo, because so that's one challenge with, we have more objective ways now to measure horse comfort, horse lameness. That's not, but a lot of it still in clinical trials will come down to the owner perception and how they think the horse is doing or feeling. So yes, they are absolutely real placebos. And then when the study's over, then they get the treatment, right? So they don't never get the treatment, but yes, for sure.
You mentioned that there was more research needed for human use of stem cells in these kinds of procedures. What risks are possible and known?
Oh, sure. So some risks are, I mean, I guess the one would be that just we weren't using them in the right way and the treatment didn't work. Another is if you were using allogeneic, meaning from a different patient, there is risk of an immune response to those cells. And again, this can vary dramatically by what type of stem cell you're talking about. With some of the embryonic stem cells or induced pluripotent stem cells, iPS cells, there's a risk that they could form a tumor because they're undifferentiated. So that's also a risk. So it really goes a whole gamut from minor problems to some big problems. Yeah. Yeah. All good questions.
Mm-hmm. Yeah. All right. Hang on.
Getting your exercise.
Sorry. Yeah. What if I injure myself?
Just the right amount of exercise.
We'll take care.
Are you prepared to deal with me
you are
before the program ends?
You're two-legged, so.
Not knowing much about the birth of the of horses, you were talking about the embryo. What about some of that, the umbilical cord blood? Are you saving any of that for some of these transplants?
Yes, that's an excellent question, and that is being done. For sure. I have not done that in my laboratory, but there's many of, I look mostly at bone marrow, mesenchymal stem cells, and some iPS work. But there's a lot of groups now looking at umbilical cord blood and tissue to harvest stem cells from. So that's an excellent question. There's not a lot of studies yet on their effect in tendon or cartilage. That's coming, and they might be very good cells. The tricky thing is you have to have a group of mares that are foaling or giving birth, and you have to be there and you have to catch it, the umbilicus, and keep it sterile. So it's quite a procedure. So you can't just dig it out of the straw a couple hours later. And if you guys know horses, they don't like to be watched while they're giving birth. You'll actually sometimes really interfere and mess them up. So they don't like to be observed, and they don't like you to stand over them. That's why we usually use cameras. But it is a little bit tricky to harvest that all cleanly, but it's certainly being done.
Well, this has been fantastic, and there's been so much in this. Maybe by wrapping up, we could you could just sort of tell us, what do you want us, first of all, like maybe there's a couple things thrown in and you can answer whatever you like, but like, what do you want us to leave here knowing out of all this stuff we discussed? But then I also had this other thought, that is there something like in this field for you that is like the holy grail? Is there something like that maybe something that's on a near horizon, but maybe something else that's not even on a near horizon, but like a dream that you're working towards or aspire towards?
Yeah.
Let's go with the dream first.
Yeah.
I think the dream is, there's two. One is just preventing injuries from ever happening, okay? And the second would be, if injuries happen, full restoration of the original tissue, which still, as far as I know, has not really ever happened. So, yeah.
No, I agree with that. And so back to the same level of performance or even better. And that's, I think, also where all these regenerative therapies come into play, but also the rehabilitation, where we can get them back quicker and at a higher level without losing all their muscle and everything in the recovery process. And I guess things to take home, I hope you guys, that this was cool, that you can see what horses can do and how they can be used to help human medicine, and that we're working together as a team to achieve that. So that's a excellent relationship that we have with engineers and also with human physicians as well. And I think that's critical to advancing the field forward.
Yeah, I thought that was kind of surprising and interesting, the part about fixing an old wound, that here's something that maybe it didn't heal perfectly, but it's healed and it's old, and is it really worth removing that and then creating a fresh wound, really, in order and to fix it even better? That almost sounds like magic, and any sufficiently advanced technology. Yeah. because to re-wound it because you know you have this new technology that will make it better.
Right.
Yeah.
Yeah,
to
that's
choose
kind of
the
awesome.
right cases.
Well, cool. Well, thank you very much. How about a nice round of applause for Dr. Lauren Schnabel and Dr. Matthew Fisher. And next week, Brain Awareness Week and nicotine addiction. So thank you very much, and thanks for your great questions. This building is still open till 9 o'clock. So thank you, and good night.
Thank you.